Hi, my name is Osvaldo Rodriguez Jr., and I am a board certified internal medicine specialist working in primary care at SIMEDHealth in Gainesville, Florida. So there's three main ways to control your blood sugar. Number one being controlling what goes down through your mouth, because dietary control and managing what you put in your system is an effective, probably the most effective way of controlling your blood sugar. Um, Secondly, exercise and regular exercise is one excellent way to reduce blood sugar. Your body's able to burn and utilize sugar when you're exercising, even in the absence of insulin. And then thirdly, we have many medications that we can utilize to help control when the above two fail, or in combination with the above two, obviously. So as far as measuring blood sugar, it really depends on the person's severity of disease. My patients who have milder disease and are controlled with either diet and exercise, they don't really have to check their blood sugar that often. Those that require medication too, and their numbers are relatively well controlled, don't require frequent monitoring of their blood sugar. Whereas my patients that are on insulin require more frequent monitoring of the blood sugar, and that can go up to 2 to 6 times a day. So it really depends on the severity of your disease. Unfortunately, diabetes can affect multiple systems of your body. Therefore, it's important to monitor your blood pressure, your weight, your vision, monitoring your feet for any injuries, cuts. All of those things can be important. On your visits with your physician, they'll most likely be monitoring your cholesterol and kidney function. And it's important to get a yearly eye exam when you're diabetic. Diabetes and smoking is a bad mix. I often tell my patients it's like adding gasoline to a fire. If you're a diabetic and you smoke, your risk of developing cardiovascular problems is exponentially increased. If you are a smoker, your risk of developing diabetes is 30% higher than a regular population. So if you're not a smoker, don't start. If you currently smoke, then it's extremely important to quit, especially if you're a diabetic. Since diabetes is a systemic disease, poorly controlled diabetes is going to affect multiple parts of your body. Starting with your eyes, you can develop deteriorating vision due to poor circulation in the back of your eyes, which can result in blindness. Unfortunately, diabetes is the main complication of diabetes is death from myocardial infarction. So your heart is affected by the poorly controlled diabetes by the blocking of your coronary arteries, which are the arteries that feed blood to your heart. Your kidneys also can develop deterioration to the point of needing dialysis, which is where you have to be attached to a machine to have your body cleansed of all its impurities. And it even affects your nerves to the point where you might have painful neuropathy, which is often a burning pain in your nerves, especially in your feet. And while we're on feet, you have to avoid injuries to your feet that can result in infections that can spread very rapidly if you're diabetic.